Hello, Myo friends. Do you ever feel like I come to you with these videos after having done free assessments all morning? If you're feeling that way, it's probably true because I made a note this morning saying, hey, you have to do a video on age-appropriate tongue ties, okay? So that's what we're talking about today. So what do I mean by that? I have done so many assessments recently, and by assessments, I don't mean a comprehensive exam. I mean, I've just been meeting with parents, helping educate them, helping talk them off the ledge because they've been given crappy advice, or advice that just wasn't going to serve their kiddo well. And it's really hard to have a conversation with a mama who knows that there's a concern for her kiddo and she wants to do something like yesterday, okay? I get it. We do anything for our kiddos. So my intention in this video is to talk about what's an age-appropriate tie, talk about working with the younger kiddos, some suggestions, if somebody like me is telling you, hey, you gotta wait, then we'll talk about options, okay? So let me just talk about the age-appropriate tie. So when I was trained, I was taught that myofunctional therapy or a tongue tie release and myofunctional therapy aren't for everybody all the time, okay? And so when it comes to a tongue tie release, if it's not a breastfeeding issue, it needs to wait until a child is old enough to cooperate, comprehend, and comply with therapy. Now, I totally know, you guys, that you're going to find somebody who says, yeah, I work with 2-year-olds. Yeah, I work with 18-month-olds. That's not going to be traditional myofunctional therapy. That might be an occupational therapist or somebody who's doing feeding type of stuff, but that's not the traditional myofunctional therapy like I'm doing, okay? So since then, since that mentor, that doctor, highly educated, highly renowned, had told me, hey, if it is not a breastfeeding issue, a child needs to be old enough to comprehend, comply, and cooperate with therapy. So there's not an exact age for that, okay? But what that means is if you've got a 4-year-old, not a good age. If you've got a 6-year-old who is has tons of behavior issues, who doesn't listen, isn't going to comply, isn't going to let you in the mouth, isn't going to sit down and work on therapy, then perhaps that is not age appropriate, okay? So there's not just this beautiful one size fits all. When I do an assessment on a kiddo and we can't even get him to or her to focus, for 30 seconds on something, there is no way on God's green acres that you're going to be able to take care of that release, that wound, like it needs to be taken care of. I don't care if you have stitches, because guess what? Those stitches are going to come out at some point and there's going to be a wound. Or some remnants of a wound, and there's going to be some scar tissue, and you have to stretch and finesse that and work that tissue. And if a kid is going to bite you or not let you in the mouth, not going to work, okay? So when I talk about age-appropriate ties, I understand that that's really hard for mamas who fall into this myofunctional rabbit hole, who know that there's a concern, who knows that something needs to be done. And that's how I end up working with younger kiddos, because I used to not even let a kiddo on my schedule until they were 5 or 6. And now I start working with kiddos younger because I have moms that say, hey, I know something's wrong and I want to get started. So sometimes we can get started. And that's the biggest thing, is sometimes we can start working on breathing. We can start working on other things. But I'm going to be saying we got to hold off on that release until your kiddo is willing to cooperate. Because if you do it at the wrong time, you're just going to possibly traumatize your child. You're going to have to do it again. And how many people are saying, hey, I'm excited about that? It's hard on mamas, hard on daddies, it's hard on everybody involved. And so if you're not 100% committed to doing it correct, just because you want to do it now, I think it's a terrible decision for you to say, hey, I want to do this against the advice of everybody else. Now, there has been a couple cases where I have worked with kiddos that were too young to have a good release, but their speech was being affected, as in they just weren't talking. And so in those cases, there were such severe ties. We had to get the release done. We knew it wasn't going to be perfect. We worked together for a year. Those kiddos are now going to grow and mature for a couple more years, and then we're going to just do it all over again because they still need to have another release done. So that's a very rare case. That does not come along a lot of the time. So one of the things that I wanted to talk about is first let's talk about what can happen if you do it too soon. So I was just saying it's not going to heal correctly, but I have consulted on several cases, and you guys, these are total outliers, but as a mom, they're top of mind for me. And if you traumatize a kiddo and your kiddo remembers that I went to the dentist, I had this done, it hurt, I was miserable. My mom had to do all these stretches and stuff, and I never want to have that done again. You risk having your kiddo being 50 years old and not wanting to go to the dentist. Okay. So we don't want that at all. But the other thing is these cases that I've consulted on, I have parents calling me and they're saying my kid doesn't take food anymore. They're on feeding tubes. And while those examples are not directly related to a tongue tie, they're related to dental trauma. So those kiddos, had something happen at the dental office, total freak show, total just a freak thing, but they don't want to now put anything in the mouth, or they create an oral aversion. So that's really the biggest thing. We don't want to do it too soon because it's not going to be successful. I have yet to see one that's successful, and I know that's a pretty powerful statement, but in my experience and my worldwide experience and all of these clients, they always end up having it done again. So there's got to be a really dang good reason. And it's not a good enough reason to say that it's affecting the craniofacial development and the dental crowding, because there's what I call a time-sensitive window. And so we don't want to be having this conversation when your child's 13. But if your child's 4, they still have a lot of time where we can get that craniofacial stuff corrected, okay, with airway ortho. Now, it's a different story if you have a kiddo who has, airway concerns and like sleep apnea concerns. Airway trumps everything. And so I do have a lot of cases where I meet kiddos and I say, hey, your kid is too young for a release, but your kid is not too young to get started with airway ortho because airway trumps everything. And so I guess that leads me then to the next thing, is talking about, what should you do? If you have questions and your child is over 3, the best place to start with me is with an exam, because that way I can see the oral structures. I get to see how they're sleeping. I get to see videos of them telling a story, eating a cracker, drinking, so I can see all of the pieces so I can help you get a plan of attack together. Sometimes that's not me. Sometimes that's me saying, hey, we need orthodontic intervention. We need some space ASAP. We need some years of growth and maturing before we worry about myofunctional therapy and a tongue tie release. So with that said, your options of working with me when it comes to this situation is really, I give you 2 options. You can work with me one-on-one in a mini Myo program, which is generally for ages 4 and 5 to about 7 or so, okay? And so in this situation, we would work together once a month for a year, and we're working on nasal breathing, we're working on chewing, we're working on many other things. We're just not working on a frenectomy, okay? We're not preparing for it, which, I mean, we really are, because we're building strength and coordination and we're working on this neuroplasticity, but we're not making an appointment for that, okay? And so like several of the 3.5 or 4-year-olds that I'm working with, we're just totally working on game-based stuff. We're working on breathing, tongue posture, mouth posture, that kind of stuff. So you have that option to do a mini Myo program with me. And that really means me, you being mama or daddy, and the kiddo, we work together and I teach you tools for the tool chest, if you will, okay? So it's definitely a fully customized program depending on what your kiddo needs. I have some kiddos that have, toxic oral habits. I have somebody who, bites the lip. Well, when you're biting the lip, it's pulling the jaw back and pulling the teeth in, so there's concerns for that. So we start working on some different things, but that's the option if you're going to work with me one-on-one. You also have the option to go right to my website and you can enroll in my digital program, Mommy, Myo, and Me. And I call that a bridge program because it helps give you things to do with your kiddo now while you're waiting for your kiddo to get older. So if you have questions, you can certainly reach out to me, but I hope this helps you understand the ceiling is not falling if you wait until your child is an age appropriate or is of an appropriate age to have a release done. You're not neglecting your child in most cases. Knowing if there's airway concerns, knowing if there's sleep apnea concerns, those type of things, it is important that we know. So I don't want you to stick your head in the sand, but I don't want you running out and getting a release, because if your kid has a tongue tie and your kid's 2.5, you'll probably find somebody in your town who will do it. And I always say anybody who would do a release on somebody that age, I'm a little bit suspicious about their knowledge about Myo or the age appropriate. The other thing is, don't go find somebody who tells you what you want to hear. I met with somebody earlier this week who had been to 4 assessments, 4 different doctors. 3 out of the 4 had said, no, your kiddo is too young for a release. You have to wait till he's a little bit older. And so on that 4th one, they found somebody who would go ahead and do it. So they were reaching out to me to get my blessing to see if they should go ahead and do it. And I thought, so why did you keep having all these assessments? And it's basically because they were looking to find somebody who would tell them what they want to hear. So if that's you, stop it. You don't want to do that. You want to educate yourself, gather information, ask questions to the right people, find people who are educated. And if you're having a doctor who says, yeah, your 2-year-old has a tongue tie, let's go ahead and release it. I'm guessing your 2-year-old probably isn't breastfeeding. And if he or she still is, guess what? There's not a problem. So you'll be fine. And the kiddo needs to have a release when they're a little bit older. So that might be an unpopular opinion, but it is mine and you're watching this, so I appreciate you. I will be back next time with another hot topic. Bye for now.